What's up, guys? Welcome to another episode of E4 Explicit Podcast. I'm Corey, and today we have, for a second time, Vivek Katz. What's up? Thank you for coming in. Or no,
Pleasure.
having us come in.
Yeah, thanks.
Again. I hit you up as soon as the coronavirus came out. I was like, hey, do you think we could talk about this? Because this is kind of terrifying. So I want to focus our conversation on that and, you know, what you got going on, obviously. But so how have you been, first of all, and like what's been happening?
With the coronavirus?
Yeah, just
all
like
right.
in general, you know?
Yeah, so, I mean, so I think we got to date ourselves, right? Today is February 13th.
Yes, 2020.
So whenever somebody's, I think, and I say that because things are happening so fast that it's important to know when we're having this conversation.
Sure.
So we had a new virus that emerged probably sometime in November. At the end of December, the Chinese reported it to the World Health Organization. And since that time, it has been spreading exponentially. The numbers are a little confusing, but the numbers have at least doubled since the beginning of February.
Jesus.
And but in the last 24 hours, it's gotten even more confusing because the way we're counting cases has changed a little bit. So the number of laboratory confirmed cases are now approximately 47,000, with the majority of all but about 500 of those cases in China. The shift overnight was that the epicenter of the outbreak in Wuhan and Hubei province has started counting cases that have not been laboratory confirmed. And so that added an additional 12 to 13,000 cases overnight.
Whoa.
But those aren't all cases that were found in the last 24 hours. That potentially goes back in time a little bit.
Yeah, to where it could have started.
Yeah. So if we count those cases, we're currently at approximately 60,000 cases worldwide. But that, I think it is fair to say that is the tip of the iceberg, that we actually don't know how many cases there are worldwide at this point.
Oh my God. Okay, so that's terrifying to me, I think, because I mean, you know, it was in China, and then they're like, does China have a tendency to kind of wait on these things until they become kind of like an international deal?
Well, I don't want to say anybody has a tendency to do anything.
Yeah.
15 plus years ago, when SARS emerged, China got in a lot of trouble from the international community because it did sit on this. It sat on the emergence of SARS for months before it shared any information with the World Health Organization. Since that time, though, they've taken great pains to build up their public health infrastructure and become a much stronger global actor. That being said, so countries are obliged to report when they have something that could constitute a public health emergency of international concern. Sure. That being said, many countries are slightly reticent to do that reporting because it's a big deal. I mean, on one hand, it's important for public health, but on the other hand, it may have implications on your travel and trade and your economy. So countries like to be sure of what they have before they report something.
Sure.
I think there's a lot of folks who are trying to comment right now on whether China is a good or bad actor in the international fora at this point. I'm trying to hold off on that.
Yeah. Okay. Because I just want to tell you some facts or some information that I have on the coronavirus, and you tell me if they're bullshit. Because
do my best.
Yeah. Because when we talked last time, you made a really good point of, you know, because I asked how come, you know, when we talked about vaccines, how come there's so much misinformation out there? And it's because you said, like, you guys are this big, and the Facebook, Instagram, all these social media platforms are so much larger, and yet people just saying whatever. I don't know how many times I click on an article, and it's like the clickbait from the person that posted it. I read it, I'm like, this actually has nothing to do with what the headline said. Now you are actually saying the opposite of what it was. Just, it blew my mind. So I've seen a lot of stuff coming in from this virus, and so they said, like we talked off camera, but like at first they were saying, because in Wuhan there's this like, I guess, open market area where there's like a lot of like crazy animals that they have, like I don't even know, like they had all these like snakes, and they had all these like, I don't know if they're eating them or doing or trading or what.
It's called a wet market.
Okay, a wet market. First of all, what's a wet market?
So a wet market, you see them in lots of parts of the world, but particularly in parts of Asia, where it is a market where you bring people come to buy things mostly to eat, but they want it super fresh. So the market itself has live or very recently killed animals.
Wow.
And then on the spot, you'll be like, I want that chicken. And so the person will slaughter the chicken and
like right in front of you?
Right in front of you, and you know your meat is super fresh. So it's called wet because it gets it's bloody. You're washing stuff down all the time, and that's why it's called that.
So now, is that basically like a breeding ground for disease and stuff? So that's where like.
So I think there is a fear that, and what's been studied over the last couple of years is that are these wet markets opportunities for species jump? So the ability for a virus in an animal to jump into a human.
Sure.
And if you think about it, it's kind of mushy, right? You might have blood from a chicken mixing with blood from a pig mixing with some exotic animal that's being traded, and people. So all the things that we worry about around the notion we call One Health, right, which is the idea that animal, environment, and human health are all linked together. They're kind of perfect storms for thinking about where you might have jumps of disease from animals to humans.
Yeah. Okay, cool. Because that's what I saw that on news.
But that being said, we don't actually know. That was the original reports, was that the virus emerged from this wet market in Wuhan. Actually, it was a seafood market, but it sold all sorts of stuff.
Yeah, it's some.
And then there were reports that it looked like it was from a snake or from a bat. Why we don't know this yet is because some more recent epidemiologic work is showing that the first case, so the cases in December, they thought were linked, this first 30 plus cases were linked to this fish market. But we're now hearing that there are earlier cases that go back to November, and we don't yet know where those cases came from.
Wow.
So I think that's why it's really hard at this point to say definitively, yes, this emerged from a bat and it jumped into humans in this location. There's still a lot of investigative work that needs to be done to know definitively where this came from.
Okay, so yeah, because that's the thing I saw. As first it was a snake, and then they showed like these crazy footage of like bat soup, like this raw bat just sitting in a bowl with soup in it, and then I'm thinking like, oh my god, like what the hell? And then but my thing is like, so I know when I talked to you last time, you said your biggest fear was having like an influenza going around like 100 years ago when it killed 50 to 100 million people, and you said at that point it was a fraction of what it could be now. Because I remember you saying if something like the swine flu or whatever it was actually did what that did 100 years ago, it would be like completely catastrophic to the world. Yeah. So what's the difference between this corona? Is it like a pneumonia thing? Is it a lung thing? Or what's the difference between the flu and the corona?
Well, let me get back to your first point, which was if you asked anybody from my community what their biggest fear was, like what was going to be the thing that was going to cause the next pandemic, the answer would almost always be either a new strain of pandemic influenza or a coronavirus, because it acts very similarly, right? It transmits very similarly. It's a respiratory virus. That being said, I don't want to fearmonger. At this point, we don't really know what this is going to look like.
Okay.
And the reason why that was something that everybody worried so much about is that those viruses transmit very easily.
Sure.
Right? If you have a cold, you're going to give me the cold, right?
It's like definitely going to happen.
Well,
yeah. More than likely,
right? And so and we capture that by something called the R naught, and which is epidemiologically it's how many people on average one person will infect. So the respiratory viruses tend to be relatively high R naught. They're
like
a little
the Ebola is like, I can't even give it to you.
if we were sitting like this, you
Yep,
could
I
not
remember
give it to
you
me.
saying
I would
that.
have to touch you.
Okay.
And I would have to touch, and I'd have to get your sweat, and then I'd have to like rub my
Yeah.
eye. So it's, when you think about how to contain a respiratory virus, it's a lot harder.
Okay.
It's a lot easier if something is transmitted sexually or there's a behavior modification that you can identify. So I think that's really frightening. And then the other thing that you then look at is what's the case fatality rate. So if 100 people got the flu, how many of those 100 people would have a severe course of the disease and how many would die? For the 1918 influenza, where 50 to 100 million people died around the world, case fatality rate was relatively small. So you're looking at somewhere between 1% and 3%.
Yep.
But that many people died because it's a respiratory virus and it spreads so easily around the world.
Mm-hmm.
I think one of the fears right now is certainly the difference between 100 years ago is we're in a much more globalized society. People travel around the world, and you can be anywhere in the world in 24 to 36 hours.
Yeah.
As opposed to a virus that really spread along, boats going across the ocean.
Yeah.
So there's great fear on that. It looks, the really positive news to date is that it looks like the case fatality rate for this novel coronavirus is pretty low.
Really?
Yeah. We don't actually know, though, in part because we don't really know what our denominator is. We don't know exactly how many people have been infected. So right now, it looks like it's about 2% based off of the numbers that we know. So if 100 people got infected with the coronavirus, it looks like on average about 80 of those folks would have a mild illness.
Okay.
The rest of actually it's like 82% it looks like right now. The rest of those, the other 18 folks would need to be hospitalized, and about 3 of them would require ICU.
Oh, wow.
And
maybe die.
Right.
Wow, okay.
So that's what we're seeing right now. The problem is, well, for good and bad. For good and bad is we don't really know what the denominator, we don't know how many people have been infected.
Sure.
There's a chance that it might be possible to be asymptomatic, so to have the virus but not show any symptoms, and it may be possible to, at that point, transmit it. So if I was sick, I might be perfectly fine, but I still might be able to get you sick. That's really worrisome when we think about what our containment measures are.
Sure.
But if you want to try to find the positive in things, the positive on that would be that there might be a whole bunch more people who are actually have the virus than we know about, which means that case fatality rate is going to get even lower and lower.
Yeah. So now if that is asymptomatic.
Yeah.
So that means, does that mean though, if I am not showing any signs that I would eventually get sick, or when I do get sick, it's just going to go from it's like not, finding out you have stage 4 cancer when you've had it, when if you would have found it at stage 1, you might have been able to, you know what I mean?
Yeah, it's different in that. So there's different terminology we use. There's asymptomatic is, you have the virus, but you have no symptoms. We also look at something called, how long the incubation period is. So that means that if you got the virus, it might take between 2 and 14 days for you to show symptoms. So if you got the virus, you might not actually get sick until day 14. That's why the quarantine, the people who are being quarantined for 14 days.
Wow.
Because after that 14 days, we think, well, that's the outer limit that we know of for that transmission site.
Wow.
So you might be fine at that point.
Might be fine at that point.
As much as we know, right? I think the point here is that there's a lot of uncertainty in an outbreak. And
so what do you do?
There's a tremendous amount of information that is flowing. There's a lot of people moving incredibly fast and spending many, many hours with very little sleep trying to work on this.
Sure.
But you have to make decisions under uncertainty.
Sure. Wow. So like you said, it's more of a respiratory thing. Now, so for instance, my girlfriend, she was in Orlando. She was at a big conference in Orlando, went there like day 1, got sick that night. Then she went to the urgent care the next morning or the next day. And they were like, yeah, you got the flu. So now the flu, can be transmitted the same way as the coronavirus, right? Just by touching almost, right? Or is it airborne?
It's airborne. It's respiratory. Shit. Right. So it's not touching, but instead it's if you cough or sneeze on somebody.
Oh my God.
And then the particles are in the air. Well, if you're in the same room and she coughs or sneezes, those particles are in the air.
So should I now we also have a dog.
I have no idea what the impact is on the dog.
I Googled it, but I Googled it and it was like the dogs can't, like, that's not something that they can transmit the flu. So, but I'm saying now she's in our bedroom, and I actually slept in our spare bedroom last night. Right? Good move? Because the room, I guess, is filled with her coughing and this and that. So he's saying every time I walk in there to check on her to bring her chicken noodle soup, I am potentially could get infected. So I need to quarantine her is what you're saying.
I am not saying that. You're definitely not saying that.
I'm just kidding.
Also, here's my public health professor, like, pet peeve.
Yeah.
There's quarantine, there's isolation.
Yeah. I know, I remember talking about this. Quarantine's
if you're well.
Yeah.
Isolation is if you're sick.
Interesting. Okay. Because that's obviously, I mean, there's a movie called Quarantine. Like, they make it like this. It's a scarier word than isolation.
It's a super scary word. But it's also super scary because if you're sick, you're sick. The idea of being isolated also implies you're also going to be treated.
Sure.
Quarantines, you're been exposed potentially, but you're not sick. And instead you're just looking around being like, when am I getting sick?
Yeah. And just waiting. It's a waiting
You're waiting.
Game.
You're waiting, and you might see somebody else get sick next to you. You're like, oh my gosh, it's gonna get worse. So it's mentally a lot tougher.
Interesting.
I think.
Yeah, I remember you said that. Like you said, if we were quarantined in here, like we would basically have to just wait in here until.
Well, with this, 14 days.
Wow. Oh my God.
Right. So now, if you think about all that, there's the situation with the cruise ships.
Oh yeah, I heard about that.
Right. So there's cruise ships where people have been infected. There's one that's docked off the coast in Japan, and people have been told you have to stay in your room. Now, if you've got a window, maybe that's a little bit better.
Yeah.
But think about like an internal room where you're stuck in there.
They're small too.
And you're just waiting, and every day you're hearing that more and more people on the boat have become infected.
Now, this is with the coronavirus.
This is with coronavirus. This is happening right now.
Wow. Okay, so why is it named the coronavirus? Is it just because, like...
Oh, it's just the name of the virus. So it has... viruses are named in different families. This is the coronavirus family.
Okay.
It actually just got a new name this week
from
WHO.
Like CP
so it's now COVID-19. Yeah. But it's interesting. That's the name of the disease. The virus has a different name, but that's fine. We'll call it COVID.
Okay, so now they're saying it's a disease because it's got to a certain level, or why they changed the name, or why they...
They just they were too busy at the beginning of the outbreak to actually go through a naming process.
Got it.
And now we have a history of naming things after the place that it came about or the population, and both of those things tend to lead to long-term stigmatization or bias.
Like swine flu.
Right, or Lyme disease, named after like Lyme, Connecticut. Yeah. So, what does that do to the real estate prices in Lyme, Connecticut? Yeah.
Damn, that's crazy to think
right,
about
so there's
that.
this entire process for how we name a disease. So part of that is trying to come up with a name that is accurate but doesn't impose bias on any certain population or animal or something.
That's actually pretty smart. Because that, like you said, that could have long-term effects of it.
And we already see stigmatization. So we already see, we're starting to see it of people from China. And
oh, for sure, yeah.
Yeah, and there's now a push to, go to your local Chinese restaurant. Nothing will happen to you, and it supports them instead of them shutting down.
I'm not going to lie. Low-key, when we were traveling, every time I would see, like an Asian person or whatever, I would just be like, is it something that they always have with when they wear the mask? Is that because I always see pictures, videos, and on TV, masks? Always, and it's only in like Asian, mainly just China.
Yeah, but you'll also see it in certain parts where there's large Asian populations that congregate. Okay. So parts of New York, you'll see people.
Oh, for
masks,
sure,
right?
yeah.
There's a couple of things going on there. One is that there's been some experience over the last few years of respiratory viruses. It's also, say, in Beijing, the pollution is so bad that a lot of people have taken to wearing masks, so it's less socially awkward.
Got it.
And now, and you know, for parts of the world that have gone through H5N1 or H1N1, it's like a cultural shift. So if you're on the street in Hong Kong right now, if you are not wearing a mask, you're looked at as almost, like, who are you?
Weirdo. Yeah.
Exactly. Or it's not even just weirdo. It's you're not participating in public health.
Ah, that makes sense.
What you are not being part of our community,
Sure.
and we are all doing this
to try to stop,
protect ourselves, but also to protect our neighbors.
Got it.
So that's a little more ingrained. That's not something that's ingrained in the U.S. for the most part,
No.
and I'm really curious if we'll get to that point. So we've started to see people wearing masks around town.
Yeah.
It's not necessarily it might be because they're sick, but it also might be just as, you know, that's what you do.
Yeah.
You put it on and you not only protect yourself, but you protect your neighbor.
So how does if it's airborne, obviously if you're blocking your nose and your mouth, it can't get through the filter, right?
Depends what kind of mask you're wearing.
Okay, like you said off camera, you have to be wearing the right mask and wearing it right. So
Exactly.
how do you what would you recommend, and how would you recommend using it?
So there's a lot of guidance out right now around masks. Some of it is what you don't want right now is a run on masks, because there's only so much supply.
Like the little blue ones?
Well, yeah, like, right, the surgical masks, something like that. There's only so much supply right now. From a supply chain perspective, most of them are made in China. So it's a bit of a challenge at the moment.
With the virus. It's like, here.
No, it's
I'm
just
kidding.
like the Chinese need them, right? Or their
yeah.
factories have shut down.
Wow.
So clearly the most important folks who need masks are healthcare workers.
Oh, yeah, for sure.
Right. So what you don't want is a situation where the worried well are buying up all the masks and then the healthcare workers don't have any.
Yeah.
So I think there's a lot of trying to figuring out what's the best guidance to give the general population. With that in mind, with that, we need to have enough supplies for the hospitals.
And the people that are actually sick.
Exactly.
Yeah.
So also part of this is we need to continue to understand this virus. So initially it was thought that it was, you know, large droplet sizes. Now maybe it's smaller droplet sizes. So the size of the droplet where the virus is impacts what kind of mask you need. So we know now, believe we know. Again, it's all, the whole point is there's a lot of uncertainty, and you gotta roll with it a little bit. At this point, we don't believe that the cloth ones, so you saw sometimes like people go and get their like Burberry mask.
Yes.
That doesn't work.
Wow.
I mean, it's nice, it looks prettier, but there's not a lot of evidence that that's terribly helpful. Is it more helpful than nothing? I don't know, maybe.
Yeah.
Depends
maybe,
how you're wearing
but
it.
You still don't know.
Like, you don't know. The next level are those surgical masks. So the ones where you like put it behind your ear and the like little blue. Those are supposed to be better, but you have to keep them over your nose and your mouth. It might not. So what you don't want is pulling it down, talking to somebody, putting it back up. Using that wrong it's pointless. Again, who knows if it's completely pointless, but it's not good.
Yeah.
And you know, it's just very situational. Now there's the next level N95s. So those are the ones you can get like Home Depot.
Sure.
And they filter out
they have like
smaller size particle. Exactly. Problem is those have to be fitted. And so a lot of times people will wear them and not actually like fit them over your nose and do a tight seal. They're also designed to be one-time use. So masks are helpful. They're important. But again, it's all part of this larger context of making sure we have enough for the right people. Are you doing all the other things in conjunction with a mask?
Sure.
Like if you're wearing a surgical mask, but you're like not washing your hands and you're touching your eyes and like you keep pulling it down to talk, right? All the things that we do, then it defeats
the purpose of, or it's less effective.
It's less effective.
Okay. All
right. So instead, there's this kind of combination of guidance right now about how to just take good public health measures to wash your hands often, to cover your cough, right? So like
that move.
Right?
Okay.
To not touch your eyes or your mouth or nose all the time.
I literally
right? I have to like
this.
sit on my hands, right? I do that all the time. We all do. To stay, if you are in a room, if you see somebody who is visibly sick, to stay away from them.
I've literally done everything you just said. Like I'm like I oh my god.
Right, we all do. We all do. So it's kind of hard guidance to feel like, okay, yeah, I'll definitely do something. The other guidance that's been floating around is to get a flu shot. Now, the flu shot will not protect against the coronavirus.
No.
But as you just pointed out, there is a lot of flu that's circulating right now.
Sure.
And there's a lot of people who are getting sick and having to go to the hospital because of flu. So you get a flu shot. It's good public health advice anyway, because it will ideally protect you against flu, or if not full protection, then make your course of disease a little less severe.
Yeah.
So it's good for you. It's also good for the healthcare system. So if they are seeing less flu patients, they can focus on the folks who come. They can focus on other stuff.
Oh man. Okay. So basically, all the stuff that you're taught as like a kid, almost wash your hands. Mm-hmm. Don't, cover your mouth when you're coughing.
Yeah.
I mean, do cover your mouth when you're coughing.
Please.
Don't. So all those basic things that a lot of people aren't doing. Now you're making me want to go, like, as soon as we leave, I'm going on like Amazon or whatever website, and I'm going to get like $100 like mask that's like matte black. It's like official.
All sold out.
Oh shit! All right. Really?
Well, for a while, I think like the N95s were sold out on Amazon, but
oh my god!
But that's part of people are definitely interested in buying them.
That's just like,
I haven't checked this week. I'm
definitely gonna check, because I want to get like a nice one, and then that way when I go into go take care of her, I can I'm gonna bring some gloves. I told her jokingly I should just get like a hazmat suit. That's probably not a bad idea, right?
Listen, when you live with somebody,
it's hard.
Clearly, that you spread disease amongst each other.
All right, fine. I'll take one on the chin then, I guess. All right. Well, I kind of assumed I was already gonna get sick with her anyway, and my throat this morning was kind of. Yeah,
so should I.
Yeah, right. Why I was gonna cancel this? No, I was just kidding. But I feel fine actually. But like you said, you could feel fine, and then I could be type asymptomatic.
Right. Well, you don't transmit flu that way, though.
Oh, okay.
I believe. I'm not a clinician, so I'm never going to give like clinical advice.
No, I know. But like, okay, let me ask you this: the H1N1, mm-hmm. right?
Yep.
Was that from China too?
Actually, H1N1 emerged in Mexico.
That's right.
In the Americas. Well, the first documented cases were in Mexico. Unclear exactly where the first.
Sure.
Where the emergence actually happened, but.
So okay, so your biggest fear is that. My biggest fear is like us thinking that we know, like for instance, like World War Z, like this thing that came out of nowhere and then turned everyone into zombies.
Yep.
Like my thing is like, oh, this coronavirus might be, we don't know a lot about it now. I read this morning or last night that things are actually declining. Like, you know what I mean? Like cases are declining, or just whatever, something is declining. Is that?
So, over the last week, every day, China has reported over 3,000 new cases. Those numbers are going down a little bit, so it was in the 2,000s last night. Those laboratory confirmed cases.
Not the ones that aren't confirmed.
Exactly.
Yeah.
So that's a good trend, clearly.
Yeah, anything like that.
I don't know how much to say about that at this point.
Sure.
Like,
you just don't know enough.
We don't know enough.
Okay.
We don't know how so the Chinese took incredibly robust action to try to contain the virus. They basically put almost 60 million people on lockdown.
In Wuhan?
In a whole bunch of different cities.
Oh, yeah.
Yeah,
okay.
In the province and a couple other cities. I mean, get your mind around that.
Yeah,
60 million people. Like, only the Chinese could even think about that logistically.
Yeah.
So Wuhan was one of those cities that went into lockdown, cordon sanitaire, call it. Before they actually went into lockdown, 5 million people left the city.
Jesus. It was also Chinese New Year too, or about to be.
Right. So a time where,
immense travel.
300 million people travel.
Yeah.
So it just if we just focus on those 5 million people who left the city before the lockdown, these lockdowns have, I think, slowed the spread, but the horse was already kind of out of the barn.
Sure.
So it's really hard to say what the next 2 months are going to look like.
Yeah. And
to me, I think actually it's about a month and a half of what's going to tell what the story is.
Okay.
Because it's, if you take that 14-day incubation period, what is the next if we take three of those incubation periods, then we'll have a much better sense of whether the cases are slowing in China, whether we're starting to see more around the world. Remember, we went from under 40 cases at the beginning of January to now over 60,000.
Yeah.
So
it's a huge jump.
In that same kind of 3 transmission cycle.
Okay.
So I think this is really it's this period of time we're going to know, is this something that we're going to be really dealing with for the next 6 to 8 months, or will it start to slow?
Okay. So how do you, if you have the what's it called? COVID. Right?
COVID.
If you have COVID, if you have COVID, is it, how do you stop it? How do you, you know what I mean? Is there, oh, hey, come get your shot for COVID and then it's over, or?
Yeah, at the moment, no. At the moment, there's no vaccine and there's no therapeutics. So you give supportive care, right?
Hey, come on, Johnny.
A little bit, right? It's the things that you do to keep people okay, but without an actual treatment.
Like fluids and electrolytes.
All that stuff.
Really?
And but there's some trials that are going on of seeing if existing antivirals are effective. There's a lot of effort right now to put a lot of money really quickly into developing possible vaccine candidates. So there's
vaccine
a group.
Candidates, what's that? People?
No. Sorry, possible vaccines.
Okay.
So there's an organization called CEPI. That is a public-private partnership with a bunch of countries and some philanthropies that is investing in research and development, and I believe they currently have 4 candidates for the coronavirus that they're funding right now.
Oh, wow.
There's a bunch of other groups that are also trying to do research and development and try to come up with what that vaccine might look like.
Yeah.
The best estimates I have heard have been that there might be a candidate available in 16 weeks, and then you have to go into trials in humans.
Yeah.
The WHO is saying it's more like 1 to 2 years out before you have a vaccine.
Jesus. And then, so because for instance, the flu shot doesn't mean, it almost has to match up, right? The flu shot with that type of flu has to match up for it to be effective, right?
Right.
So could that happen where oh, cool, we got this vaccine for the coronavirus, 1 to 2 years later, it comes back, we use that vaccine and it's not effective because it's changed in some way, the molecules?
So if it's mutated.
Yeah.
I don't know.
Yeah, I know. Predict the future, Rebecca. Yeah, I know.
Coronaviruses certainly can mutate. We haven't seen that much mutation in MERS, and that's been circulated since 2012.
MERS?
So SARS is a coronavirus. The cousin from SARS is MERS. Middle East Respiratory Syndrome.
Yeah.
So that's we've seen about 2,000 cases since 2012 for MERS. It's never really sustained multiple generations of human-to-human transmission. It's mostly been isolated animal to human.
Interesting.
And then there's been a couple of more kind of discrete outbreaks that have happened.
So and also side note, all the kids at home, so when you see a thing of 20,000 people a year die from the flu, I think vast majority of them are elderly and newborn infants, right? Not able-bodied 31-year-old, right?
You're like, am I okay?
Yeah, am I good? Like, am I gonna die? No, you know what I mean? Like, because that's like a stat that I feel like is very fear-mongering and thrown out there a lot.
So often seasonal influenza. There's two different kinds of influenza. There's pandemic strains and there's seasonal strains.
Which is the pandemic, which is like a corona.
No.
Nope. All right. See.
So, so for influenza.
Got it.
There's seasonal influenza, which is what we get every single year.
Allergies.
So when you go get your annual shot, and you will all get your annual shot, that's for the seasonal influenza. And there might be multiple strains that are circulating in any given year, and that's why you get a different one every year, because it's different strains.
Okay.
Most of the folks who have a really adverse, nobody has flu is bad.
Yeah.
Like if you really get the flu, you're sick.
Yeah, it's bad.
I mean, you are home and you are really sick.
Yeah.
It's different from a cold.
It's miserable.
It's miserable.
Yeah.
The folks who end up in the hospital or get secondary pneumonia do tend to be the elderly.
Okay.
So we've, I haven't checked the numbers in a couple weeks, but a couple weeks ago, 8,000 U.S. citizens had already died from flu, and 100,000 had been hospitalized.
Since 2020?
This season, this 1920 season.
Got it.
So we had a couple years ago, where 80,000 American citizens died of flu. So it does kill a lot of people.
Jesus.
On average, it's like 20,000 people every year. So, but you're right, it is mostly elderly. Pandemic strains of influenza, so that would be H1N1 or H5N1, so avian or swine flu. Mm-hmm. Those act a little bit differently. So they tend not to have the same type of seasonality. They'll only circulating when it's cold versus hot.
Got it.
And some of those strains, we've actually seen a flip. So like the 1918 influenza pandemic, that acted in kind of a weird way in that it basically turned your own immune system against you. So the people with the very strongest, best immune system were the folks who got the sickest and died.
What?
Exactly, right. Which is why in 1918, a lot of the deaths were in super healthy, military age men.
Wow.
Which was particularly problematic since we were in the middle of World War I.
Yeah.
So it really depends. So now the coronavirus is a separate family.
Okay.
Like it's not an influenza. To date, most of the people who have had a severe experience with coronavirus have been, the guy from WHO said elderly, over 40. I'm like, whoa.
Yeah, wait a minute.
Wait a second.
Yeah.
Over 40 or over 60?
Are you calling me elderly? Yeah.
Right. Like, how do I feel about this? But it was most of the folks who had a severe experience have been older or having an underlying health condition.
Got it.
But not always. There have been examples of folks who were in their 30s who looked like they were previously healthy, who succumbed to the coronavirus.
Damn. And now you said the corona is like the family, like that.
It's the family of viruses.
Got it. Okay. Did you see that guy, that doctor in Wuhan?
So he was in his 30s. And
he didn't die though. I read the article said a doctor dies, and when I read it, it says he didn't die. They retracted that. He's in critical condition. Regardless.
So to my knowledge, he has died.
Oh wow.
But this is, I think, speaks to a lot of the back and forth and how information is controlled in that regime.
So put it in perspective of like how, because we're obviously talking to China. China's talking to a bunch of other countries because all these other countries are now having cases pop up of coronavirus. So how massive of a job or whatever is that to kind of conduct not only your own quarantine or lockdown of 60 million people, on top of working with a dozen other countries.
So it's more than that. It's 196 countries, right?
What?
So I think this is the job of the World Health Organization.
Okay.
So we have a UN entity that
who?
Yeah, who?
When you emailed
WHO.
Me, who? I'm like, what do you mean who? Who's who?
Who?
Like,
What?
Yeah.
So I call it WHO.
Yeah.
It is their job, and the member states, so all 196 countries have empowered the WHO for global governance of disease. So there's a treaty, it's called the International Health Regulations, and in that, it outlines the responsibilities of the WHO for this very, very kind of event.
Interesting.
Right, so it's actually the WHO's responsibility to be, the keepers of the evidence.
Oh, wow.
To being able to share that information with all the other member states, to providing, so they were the ones who declared this a public health emergency of international concern on January 30th. Once they do that, they also provide evidence-based travel and trade recommendations. Then the countries are supposed to abide by them, but most of them aren't. Because WHO said no travel and trade recommendations, and a whole bunch of countries put, say, like travel bans in place. So that they are the organization that is supposed to be governing the global response.
Really? So, and they're obviously funded from all the 196 countries, no?
They're funded? Yeah.
Aren't they?
Well,
yeah,
they're funded as a UN organization. So that's a whole nother podcast, how they are funded. They're funded through assessed and voluntary contributions, and actually only about 20% of their budget is from the assessed contributions. The rest are voluntary.
Wow.
And every time there's an outbreak, after Ebola West Africa, they set up a contingency fund for emergencies, which was supposed to be, here's $100 million, and, when a new event happens, they could just use that money and go. But what ends up happening is every time there's an emergency, they end up issuing an appeal saying, please, countries, Gates Foundation, help us out.
Yeah.
So it is a nonstop hustle to try to get the money we need to protect the world.
I remember you telling me about the Gates Foundation last time, of how they had that cool thing on the website.
Oh, yeah.
Where it showed you it just gave you basically a diagram of if some disease happens, this is the outcome and stuff like that, as far as.
So what they had done, and
Bill
Gates
Melinda
published
Gates.
an article.
Yeah.
I think it was in New England Journal of Medicine, but I have to double check. That where his team of modelers modeled out the probability of a large-scale pandemic that could kill 30 million people. And then what they were able to do in that visualization is look at, okay, so if we were able to get a vaccine quickly, if we were able to get a vaccine into the general population within a year, how many lives would be saved?
Sure.
And then they were able to say, well, if we could get a vaccine into the population within 6 weeks, we would save 29 million lives. So clearly that's the goal, right?
Yeah.
Of how fast, trying to move the global research and development community to a place where they can rapidly develop medical countermeasures.
Yeah. Yeah, no, I looked at that graph when I got home and I started playing with it, where it was oh, if you respond to this time, only this many people will die.
And that's actually the entire theoretical framework behind what we do, is that if you can detect that something's happening quickly, then you can respond quickly, then you can save lives.
Yeah.
If you don't, this is why the asymptomatic stuff is so scary, because if you don't even know that something's going on until a whole bunch of people are infected, then it's hard to save those lives.
And then also wherever it comes from, the country itself has to kind of be responsible enough to announce hey, listen, we got some serious shit over here.
And have the capacity. I think one of the fears with this outbreak is that so China has pretty sophisticated public health infrastructure.
Yes.
The United States has pretty sophisticated public health infrastructure. What about all the countries that don't?
Yeah.
So if the key is detecting, what do you do if you end up in a country that doesn't have good laboratory diagnostics and a weak surveillance system? Not because they don't want to, just because they don't have the resources.
Yeah, the resources. Yeah, there's a ton. Probably more than not.
There are in the era of One Belt, One Road, the Chinese have done a lot of work in Africa. There's a tremendous amount of population movement between China and Africa. Ethiopia Air is continuing to fly from China to Africa. There's a lot of countries in sub-Saharan Africa that don't have strong diagnostic testing capacity. And in fact, I think South Africa was the first country just to begin testing for coronavirus this week. So I think one of the fears is going to be has the virus already reached Africa? My guess is yes. And not just Africa, like which parts of Africa?
Yeah,
is
if
it,
it's
is
like
it
West
going
Africa,
to,
like remember like what we talked about last time.
is it going to Nigeria? I mean, you can.
Yeah.
There's a whole bunch of folks who have tried to start doing the modeling of where the flights go,
Sure.
and from those locations, what's what does the secondary transmission look like? What is the capacity of those countries to deal with this? If, on the other hand, 80% of the people who are getting sick are not getting all that sick, well, then they have some other problems they have to deal with first. So there continues to be an Ebola outbreak in the Democratic Republic of Congo. It is of concern. Continues to be a public health emergency of concern. There are really horrible things happening where first responders are continuing to be attacked violently.
That's right.
But there's also been more people who've died in the country from measles during the same period of time. So I think one of the things is going to be how to manage if the virus lands in a population that has all sorts of other health problems. There's still going to be a question of how to prioritize what you respond to and how do you manage that.
Like what's more important, coronavirus, the Ebola, or the measles?
I don't know.
Yeah, that's crazy.
And I think those ministers of health are going to be in a really tough situation.
Damn, that sucks.
It does suck. It's about which is why it gets back to we know what we need to do to build capacity to prevent, detect, and respond to these outbreaks.
Yeah,
it's not a secret.
Yeah,
it's just been incredibly frustrating and difficult to find the resources to help countries build their capacity, and for the countries themselves to prioritize this amongst all the other things that they have to do.
Yeah. If you had a magic wand, right? Two questions. One is a magic wand, and it was like, okay, boopity bop, anything you did with that magic wand, you could fix anything in the world. How would that work? Like, if you could fix, would you just eliminate diseases? Would you find cures for everything? You know what I mean? What would you do if you could fix?
My list is so long. That's unfair.
Or maybe just stick to the coronavirus, I guess. I don't know. What would you do to
I was going to say, could I get a good pull-up?
Yeah.
A handstand push-up finally?
Yeah.
No, I mean, clearly, and then the mom in me is like, well, I want eternal health for my children.
Of course, yeah.
Right?
Live forever.
Around coronavirus, it would be really fantastic if we could get a effective, safe medical countermeasure really quickly.
For just the coronavirus.
Yeah, but I think getting to the point where we have a research and development infrastructure that has the capacity, that is well funded, that is able to integrate all the really fantastic advances in science that are happening, and that can get to a point where we really can develop these drugs and vaccines quickly so we can save lives.
Yeah.
I think that would probably be my magic wand.
So just have
the academic in me is
Yeah.
International norms and global governance of disease and better systems for information sharing and figuring out how to handle all this misinformation. But and then it's not just for coronavirus, right? Then it's a platform and a system that can be operationalized for whatever the latest threat is.
Yeah. Okay. So, what is, if you had, in your crystal ball of telling the future, predicting the future, what do you see, or what's your gut telling you about this particular coronavirus?
I don't know. As I mentioned before, I think in the next month and a half, we'll have a much better sense of, is this going to wrap up by June? Or are we entering into a phase where we have to kind of really shift our thinking on a whole bunch of fronts? So, do we get to a point where it is the norm for everybody to walk around with a mask? Do we have to get to a point where we have to really think very carefully about our supply chain management? Do you know that almost everything in an emergency room on a crash cart has at least a part of that's made in China? So if we are disrupting our supply chains, and in this wonderful globalized society, what does that look like, and how do we have to really change our thinking about where we make stuff, redundancies in our systems? Do we get to a point where, like I said, everyone's wearing masks? Do we think about mass gatherings differently? Do we think about travel and trade differently? I don't know. I really don't know. And I think guessing at this point is difficult.
Yeah.
I am incredibly hopeful that the tide will turn and this will kind of go back into the vault or wherever it came from, like kind of like SARS did. But I don't know, and I think it's too early to tell. I do feel, though, that we have to switch our mindset from containment to mitigation. So are we making sure? As I mentioned, I think the horse is out of the barn. I think it was hopeful but not realistic to think about just managing 15 cases in the United States.
Yeah.
I think we need to be switching to be thinking more about hospital preparedness and non-pharmaceutical interventions and providing guidance for schools to think about closures. I mean, all of that to be a little more forward-leaning in thinking about how we're preparing.
Yeah, I mean, this morning you said, you guys are potentially, what's the Chinese students, because we're at Georgetown, basically, University right now, basically.
We are at Georgetown University.
Yeah,
yep.
So tell me about, like, what you guys, or what you propose to kind of maybe even...
Well, I think it's what is really cool about this university. It is a global campus, right? And not only do we actually have a campus in Doha, but we have students from all over the world, from China, from all.
But
all
you
sorts
have a
of
campus. We have a campus.
We have a campus in Doha. Yeah.
In China?
No, Doha in UAE, in the Middle East.
Oh, I was like, I'm thinking of like Wuhan. I don't know, like the provinces.
It's all good.
Really? Georgetown?
Yeah.
Damn, that's cool. I didn't know that.
Actually, a lot of institutions now have locations in other parts of the world.
Look at them. All right, cool. That's
cool.
That's
what's really neat, right?
That's awesome.
And we have amazing students from all over the world. And we have, on any given day, we also have an open campus. So I don't know who's on campus today.
That's true.
Also really exciting. And it's the type of energy that contributes to the advancing intellectual thought.
Mm-hmm. Big time.
All awesome. But also means that you also have to think about the implications for that. And if we have a virus, say, that is spreading around the world, what does that mean for our little community here and for our network of communities around the world? And so one of the things is, we have a lot of Chinese students, and we're really fortunate to have them. And a lot of them are going to be graduating in the next semester, which is, yay for them. We want to celebrate that. There's a current challenge is that the State Department currently has a travel ban for nobody is being allowed from China into the U.S. who's not a U.S. citizen or a close family member. So, we are just at the beginning of starting to think about, well, what does that mean for our students? Does it mean that, and it's, I think, way too early to start the planning of, does that mean that, their parents might not see them graduate? Yeah. So, but we just don't know yet.
Yeah. Okay. That's crazy, though. That would suck.
Yeah, well, of course it would, right?
Georgetown,
but
too.
Again, it's this difference of, like, if this is not that big of a deal, then not being able to watch your kids walk across the stage becomes really disturbing.
Yeah.
If we're in a different situation in 5 months where lots of people are getting sick and unfortunately lots of people are dying, then not being able to watch kids walk across a stage is kind of the least of our worries.
Exactly, yeah. No, that makes sense.
And I really think we are, again, it is the middle of February, we're not at a position yet of knowing what that future is going to look like.
Yeah, makes sense. Well, that's scary, but good that you kind of don't know, I guess, everything, which is, it's kind of basic. It's literally like every day there's something new that comes out.
Literally every day.
Literally, yeah.
And that is actually the really neat thing, so that there's a global community of scientists and epidemiologists and legal and governance. Everybody in the world is weighing in on this.
No, for sure.
Which is exciting, and lots of new ideas and lots of new information is emerging every day.
Yeah, no, I know. Even when we were emailing, just in like the 2-3 day span, it was like, I emailed you, and you're like, oh, now this is happening, and the next day, oh, now this is. I'm like, Jesus. So it was just like,
yeah,
one day.
It is evolving extremely quickly.
That's crazy.
Which means that those of us trying to keep up on it are a little tired.
Yeah.
Those who are on the front line. Are trying to do the best they can with evolving information. This is the time where we actually thank God for frontline healthcare workers who are willing to be out there and save lives and not know what they're actually dealing with.
Yeah, definitely.
And then we see where it goes.
Yeah.
And also this is where preparedness is important. So contingency planning and thinking through all the things that could happen and making sure that regardless of what those contingencies are, that
you're ready for
that
it.
we are ready for it.
Yeah. How many cases are in the U.S. real quick?
I believe 15 right now.
Just 15.
That have been laboratory confirmed that we know about. There are hundreds of people who are currently under quarantine. They're being quarantined at military bases. Okay. So these are folks who were flown in from China,
sure,
but are in that 14-day quarantine period.
And how many near the D.C. metro area?
At the moment, there is not a single laboratory confirmed case in the D.C. metropolitan area. I will say, though, that in the past 24 hours, CDC has admitted that the diagnostic tests that they sent out to all the states were flawed. So it's hard to know exactly what we're dealing with at this point.
Come on, CDC. What are you doing over there?
I think they're trying to go as fast as they possibly can. I can't make a diagnostic test, so I don't want to be like, oh, you should have done better.
Yeah.
Right? It's hard.
I definitely can't do it.
Right? But that's also really worrisome. Are we making our policies based off the fact that, we only have 15 cases at this point? I think I would be shocked if we do not see many more cases in the U.S.
Yeah, I would.
Not
be
just
too.
more, I mean many more.
Yeah, like thousands.
At least hundreds.
Shit. All right, well.
I mean, it's back to how the virus spreads. If we have one, then it's
airborne. There's got to be, Then
we have multiple generations.
Yeah. Jesus. All right. Well, thanks for scaring me again.
It's what I'm here for.
Yeah, no. Yeah. So I'm never inviting you to any of the parties or anything.
Great. No problem.
Just kidding. But seriously, thank you again for coming on. And I'm probably going to be emailing you in the coming days. And if I hear something crazy, I'll just ask you probably.
That's what we're here for.
Yeah. All right. Cool. Well, like I said, thanks for coming in. And that's another episode for the E4 Explicit podcast. See you next time.